We have with us today Cathy and Joe. Cathy is 60 years old. She's been a patient since March of 2004, so it's almost 5 years. She's been on testosterone replacement for 3 years. And Joe is 55. He's been my patient for 3 years and has been on testosterone replacement for that period of time. So both have been on testosterone for 3 years. So let's start with Cathy. What were the problems that led us to checking your testosterone level?
I was feeling very fatigued. I have MS, and fatigue is my main symptom. And I also was very, very dry during sex. I had an extremely hard time having orgasms.
How long had that been going on?
My whole life.
Your whole life? You had
My whole
difficulty
sexual
with
life.
vaginal dryness and difficult orgasms your whole life?
My whole life.
Okay. And also you had some depression and anxiety?
Right, yes.
Okay. And that's about it as far as the problems before
Yes.
the testosterone?
Yes.
And Joe, what was your problem?
Okay, my problems were not being able to get an erection and not being able to ejaculate at times, not being able to perform sexual activity the way I like to perform sexual activity.
Had you had a loss of libido also?
Yes, I had a loss of libido.
Now, how long had that been going on with you? How long had you noticed that problem?
Approximately 3 or 4 years.
Was it getting worse?
Yes, it was getting worse and worse.
Okay.
And well, the reason I noticed it was getting worse and worse is because I found a partner that I was engaging in activity with. And a lot of times I couldn't perform to the extent that I wanted to perform.
Okay, so then we started both of you on testosterone replacement. Obviously, we checked your blood levels. The blood levels were significantly low. And Cathy, what did the testosterone do for you?
Well, I started to get much wetter during sex, and I was getting orgasms. My fatigue with the MS I especially noticed because it really lightened up. I still get a little fatigue, but basically on a day-to-day basis, it's very, very minor.
So there's been would you say, a major improvement in your fatigue level?
Yes, I would say that.
And the testosterone got rid of a lifelong problem with orgasms and
Yes,
sex?
lifelong. I had a lifelong. It would take me an extremely long time if I did have an orgasm, and I wasn't very lubricated.
Would that go back to your late teens and early 20s also?
Well, no, because I really didn't achieve orgasm until I was like 26.
26. And you were sexually active before that?
Since I was 18.
Since you were 18. So, and your first orgasm was at 26?
Yes.
And now the testosterone replacement has made a major change in the whole sexuality part?
Major change, yes.
Okay. It sounds like you have that disease that I believe exists, what I call post-adolescent testosterone deficiency, where men and women come out of adolescence without ever secreting quite enough testosterone to become fully sexually and mentally mature. Now, it did not have any effect on your depression or your anxiety, the testosterone replacement?
No.
Okay, so none of that was testosterone deficiency related?
No, I don't think so.
Okay, and Joe, what did the testosterone do for you?
Well, number one, it built up my sex drive, and number two, it's gotten me to the point where I feel that I'm able to perform sexual activity satisfactory, for myself, because I was not able to ejaculate, and now I'm able to ejaculate on a regular basis, and it's helped me to be more energetic. Okay, when I first received the shot.
Has there been a major change in your sexuality and in your energy levels?
From the point of before I started taking it,
yes,
and to this point, yes, there's been a major change.
Have you noticed any side effects?
No side effects for me.
And Cathy, what about your side effects?
My side effects were slight hair.
Slight.
Hair growth on my arm and on my face.
At the beginning, when we first started you on testosterone, you were getting about 5 times the dose you're currently getting, if not more.
Right.
And have you noticed that with the smaller dose that there's less of a problem with the hair?
I've noticed a little bit of a change with the hair.
And what about the facial hair?
The facial hair, well, it's hard to know, like with my age, whether that would normally have just happened. I noticed more hair on my cheeks.
But not a major problem.
No, I'm just noticing it. So it's not a major problem.
Would you have, either of you have any reservations in recommending testosterone replacement to other people?
No, definitely not.
Been a positive effect on your lives?
Yes.
Has it been a positive effect on your relationship?
Yes.
Yes.
Okay. Well, I want to thank you both very much for coming in and doing the video. I'm sure people will be interested in hearing your story, and hopefully they'll get on it also. So thank you again.
You're very welcome.
You're very welcome, Doctor.